Story over the weekend about a baseball player, a Red Sox first baseman. You may have heard of him. It's Mike Napoli, and he says that sleep apnea, the condition that he had, was so bad he considered retiring from baseball. Dr. O'Giles is joining us from the famed Clayton Sleep Institute, and you've heard this story before.
I have. Thanks for having me this morning, John.
Our pleasure. What do you think of the new digs?
Beautiful.
That'll
Great
keep
job.
you awake. Yeah.
These will keep you awake.
Yeah.
But the Mike Napoli story is very interesting, isn't it?
It is. And he went and had surgery in September. And he said now he can play again.
Yeah, I thought this was a very interesting situation for Mr. Napoli. He was to the point, here's an athlete in the prime of his life, a young man, quite accomplished, who was having difficulty. He was sleeping in the dugout, sleeping in the clubhouse, having to take himself out of games because he couldn't stay awake, couldn't perform.
Yeah.
He noticed, and his team noticed, a reduction in his production as a professional, and sought help at some point, and ended up electing for a surgical intervention, which was a reconstruction of his jaw.
Yeah. Are you familiar with this?
We are.
You do it often?
We don't recommend it
like
often.
to do it.
We don't recommend it often, but we're fortunate in St. Louis that we have the full range of opportunities for therapy for our patients, including major surgery and minor surgery. So it's quite a complete resolution that he's had, and an exciting development.
The surgery, and I'm reading here, involved fracturing both his upper and lower jaw. His left lip and part of his face is numb, a condition that he may have for life, and he's had to put up with weeks of drinking a liquid diet. Okay, but now things are getting better.
He should be better. So what they did, if we recall, what obstructive sleep apnea involves is that when the person goes to sleep, the muscles relax in the back of the throat, the tongue frequently and the jaw fall back and fully or partially block the breathing pipe. What they do with the jaw is many of these folks have some abnormal setback of their jaw. They actually go in surgically under general anesthesia, and a highly skilled ear, nose, and throat physician will open the tissues up, fracture the jaw, and physically move the person's jaw forward, wire it together, and when it heals, they'll have a new shape and new movement of their jaw.
Yeah. I think back on Reggie White from the Green Bay Packers. He died back in 2004, and some say that was attributed to complications from sleep apnea.
It is. An NFL lineman, because of the size of their necks and the musculature and so forth, have extremely high rates of obstructive sleep apnea. It's just an anatomy problem for them as well. And I think the translation for us is how this moves into our friends and neighbors here in St. Louis, and the number of folks who are walking around there with undiagnosed sleep apnea and struggling at their work and their profession.
All right. Dr. O'Giles, thank you so much for coming in.